Welcome to the Secrets to Mindful Health, where we explore the hidden truths of wellness in all its forms. From physical and mental health to spirituality, join me, your host, Beth Warren, at Nourished by Beth on Instagram and TikTok, registered dietitian for over a decade, and single mom of 6, as I share my personal journey overcoming challenges towards self-love and wellness. Together with my guests, we will inspire and motivate you to prioritize your well-being and create a life of balance and fulfillment. Let's embark on a transformative journey towards a healthier, happier you. I'm glad you're here. In this episode, Dr. Michael Stein delves into the nuances of plastic surgery, discussing the trends, who truly needs or wants surgery, and the importance of safety in these procedures. We explore the motivations behind individuals seeking these interventions, address the societal stigmas associated with them, and emphasize how surgery is just one of many interventions alongside diet, exercise, therapy, etc., to achieve the desired end result. Dr. Michael Stein is a double board certified and fellowship trained plastic surgeon. He has a busy practice on Park Avenue in New York City where he specializes in breast and body plastic surgery, specifically mommy makeovers. His breast surgery and tummy tuck techniques have been published in academic journals and textbooks, and he frequently presents his work at international conferences. He can be found on Instagram at Dr. Michael Stein. Welcome, Dr. Stein.
Thank you so much for having me.
I feel like I pulled you on here. I have motivations for that. One is because people on here know that I'm a dietitian in private practice
hmm
and I help people with weight management, and they often come with other issues than just fat when it comes to their weight or things they don't like about their body. Let's just put it like that, that
hmm
they think will be significantly changed from diet and even exercise alone. And sometimes I do body composition tests and they don't have, let's say, a lot of fat, or they have something called visceral fat. And I explained that even if you lost 5, 10 pounds, you still might have this belly, or you still might have men and their love handles, and they want to spot burn fat. So I'm
hmm
like, oh, I need to get you on here to just help explain this and help explain like these mommy makeover concepts and why people might come to you when it comes to their weight or their looks.
Of course. Um, I guess I'll begin by describing the anatomy, which is quite simple. So many patients come to my office, men and women alike, that they say, I don't like the appearance of my flanks or my abdomen, whether they're a mother or not. Mommy makeover is a bit of a misnomer because many patients undergo mommy makeover surgery that are not mothers. It just means a combination of breast and abdominal surgery at the same time. But in essence, despite exercise, despite diet, there are anatomical changes that happen from pregnancy or just naturally. And certain changes like rectus diastasis, um, or in men, visceral fat pushing on the fascia and leading to rectus diastasis. That's how it happens in
Mm.
men. In women, it happens from pregnancy. The hormonal imbalances actually attenuate or stretch the fascia, and then the mechanical strain of the baby pushes on the fascia. Whatever the reason, there are anatomical changes that are permanent, that can only be addressed technically from tightening the fascia in surgery. So um, it's very busy. This is a very common procedure. You can lose weight, and when you lose weight from your subcutaneous fat as well as your visceral fat. So going back to the anatomy,
Mhm.
if you think about your abdomen, you have your skin first, then you have a layer of subcutaneous fat, and then you have that fascia, and that fascia is like a wall that protects the important stuff of your abdomen, all the organs. And underneath the fascia, where all the important stuff are, is visceral fat around your organs.
Mm.
So, so first of all, if you lose weight from both subcutaneous and visceral fat.
Mhm.
As surgeons, I can only address the subcutaneous fat. So I can do
Mhm.
liposuction to make that layer thinner and sculpt, muscle groups. And I can remove the skin and actual fat to improve the contour. But visceral fat, as you know, no surgeon can address. It's too dangerous. You can't go into the abdomen and just take out a visceral fat.
Mhm.
So, as you said, having a dietitian to really get you on a good diet and having an exercise regimen, all this stuff together addresses visceral fat and makes you look better and better.
Right. And that's why visceral fat's an even greater health risk because it's pressing on those organs. So it's still a vital component too.
Yeah, and I mean from a physical standpoint too, if you're looking in the mirror and you see a bulge, even after you have a tummy tuck or any plastic surgery procedures, it could be that you have excess visceral fat, right?
Mm,
And the only way to flatten your stomach is to diet and
right.
exercise to decrease that visceral fat layer, which is better for you health wise as well.
Yes, and I think that points more towards the idea of like expectations with surgery, because you share that you can do get rid of some or all of the subcutaneous fat. Is it even possible for all? But you might have a bulge, and then therefore you have to take another further step if you wanted to look differently. So how do you manage people's expectations? And I'm curious, even the stories you hear, like shout out some crazy things you heard from your people coming to see you.
Well, nothing's crazy. I've heard it all, really. It's really the mommy makeover population is 80% of my practice. What I hear a lot is patients saying, I don't want scars. I don't
Mm,
want scars. I want lipo. I've seen 3 or 4 plastic surgeons. They all want to do a tummy tuck on me, but I came to you because I know you're great at lipo. And the truth is, surgeons tailor their procedures to your anatomy. And to meet your
mm,
expectations and to kind of hit a home run in surgery, you need to pick the right surgery for the right patient. And if you have excess skin, if you do lipo, it could even make it worse. It could exacerbate that skin redundancy. So you really have to do a tummy tuck if you have excess skin. Really, if you want that flat abdomen, and let's say you've had a couple kids, you have a rectus diastasis, you have a bulge, you have excess skin, lipo is not the procedure for you. So I say no to patients all the time when I
mm.
say, I'm going for the home run. I want to make you happy. I want to make you look great. And to meet those expectations, I can't do lipo alone.
Yeah, that's huge. And I get that in my practice too, where they'll want X, Y, and Z, but not be willing to eat the food that will get them there, just
Totally.
because they just don't know. So it's such a, I think it speaks so much to someone's expertise when they say, I don't recommend that or I can't do that, and because you're not going to ultimately meet their goals and they're not going to be happy. But when it comes to these surgeries, so diastasis recti also, isn't it a misconception that people think they could fully close it once they have it after babies?
Yeah, I mean, um, so what I was saying earlier was it's an anatomical entity, right? You have your abdominal rectus abdominis muscles, and they're surrounded by fascia. And
Mm,
so when you have a baby, or in men when they work out a lot and they're putting strain on that fascia, that it mechanically stretches permanently. And so you can strengthen your abs and make your abs more taut,
mhm,
but to a certain degree, the stretch, the change is permanent. And the most sure way to fix it is to look at it and to suture it back together and to tighten it permanently so it scars down in a new position and bring your ab muscles closer together. So, I have patients that have a very large rectus diastasis and they don't want a tummy tuck, and they say, I'm working out every single day. I have a trainer, and I don't want to burst their bubble, but to a
mhm.
certain degree, like, one surgery can correct it right away, and it's unlikely that they'll correct it to that extent doing lifestyle stuff alone.
Right. I mean, this is all like I'm already taking this all in. I went for an MRI for like a pelvic thing, something unrelated. And you know, when you go for the, well, you're a doctor, so of course you go through for a procedure or something, and then you find that information that you really just didn't need to know. Like it's not unsafe, and you just don't want to know. So I read my report, and thank God everything was okay. But then it said signs of diastasis. Well, how do you pronounce it again? Because everyone, that's
There's
another.
different ways to say it, by
Oh,
rectus
okay. Good.
diastasis. Yeah.
Rectus diastasis, signs of rectus diastasis. I was like, could we just not like shout that out that I have 6 kids and I'm extremely fit and I still have it as seen in an MRI that they notated.
It's interesting you point MRIs out, and this is a safety thing that's actually quite important to note. Is a lot of women in that fascial layer don't just have the rectus diastasis; they have hernias. They have
Mm,
little holes in the fascia, and at times, more commonly, fat will pop out of that hole. And rarely, bowel loops, like your actual intestines, can come herniate out of the defect in the fascia. And that's a definite safety thing from a surgical perspective. Like, if you examine your patient and you see these any sort of abnormalities on examination, you need to get these advanced imaging like CT or MRI
Yeah.
to confirm and get a general surgeon involved to fix the hernia at the time of the mommy makeover. And I actually have done that multiple times.
Hmm.
And so it's really important to work up the patients adequately.
Yeah. Okay, fine. So I won't be mad at them for pointing that out because it
No,
could have been a
it's a good thing. You want to rule out more sinister things. You
right.
know.
I do hear hernias a lot, and I know that I wonder if this is also something I hear from women. They might know they have a hernia, or it's very visible, or it's painful. It heavily restricts the exercises they can do. Has nothing to do with their overall size. It's pretty thin women sometimes, and they have it. And then I hear them saying, "I'm waiting till I have all my babies before I fix it."
I mean, the truth is, you need to go to an expert and you
Yeah.
need to get an expert opinion. And every hernia is different. Some are
Mm.
very, very small and inconsequential, and some are
Hmm.
large. Some have bowel loops coming through them. And it really speaks to safety in plastic surgery. Like, there's so much social media around plastic surgery. It's
Yeah, can we
becoming like
discuss
going,
that? Like all
yeah.
this, it sounds like it's so easy breezy. I mean, you reference scarring, you reference being careful about your type, body type, ethnicity, I think is also something, age, I'm sure. Like, let's talk about the risks and safety measures.
Well, we're talking about hernia. So along the lines of hernia. So, a lot of people treat liposuction like it's not surgery.
Hmm.
And because there's no cuts and the recovery is, more or less minimal compared to a tummy tuck, people don't really take it seriously. But a lot can go wrong with liposuction, from minor complications like contour regularities to life-threatening complications potentially. So a hernia, for example, if you're not meeting, for example, a surgeon before your surgery, you're seeing them the day of surgery, and they don't work you up adequately and they don't examine you, and you have a hernia with a bowel loop coming out, the liposuction cannula can actually cause visceral injury,
Mm.
right? So, from a safety perspective, see a board certified plastic surgeon that's accredited by the American Board of Plastic Surgery. See your surgeon before surgery, get examined adequately, get worked up. You have to be optimized before surgery. You can't just like treat liposuction like it's going to the dentist, and it doesn't matter what dentist you go to, you just want your teeth cleaned. It's like, these are big procedures.
Yeah, and I wonder if that's why it's so common. You hear these sort of stories that people cross the border to get a crazy plastic surgery, or like, is this why? Is it because it's pretty entailed of a process for due reason? Some people maybe might not want to do it, or I guess spend the money behind that and think it's sort of not a big deal.
It's becoming partially due to accessibility via social media. It's becoming like people think it's not a big deal. And safety is imperative because you want a beautiful result, but you also want a surgeon that's thinking about all the other things that, for your general health status, not just your surgical result.
Right,
So you need to see the right person.
right, right. When it comes to getting rid of excess skin or stretch marks, how does that relate to surgery? Like, think of like Ozempic or drastic weight loss. How do how does that play into the plastic surgery sphere?
Um, GLP drugs like Ozempic, Mounjaro, all these weight loss drugs have really um, made massive weight loss much more prominent. Many more patients are presenting with excess skin because of their precipitous weight loss. Just like if someone undergoes bariatric surgery and their stomach gets stapled, or they get what's called a Roux-en-Y surgery, they lose their weight very quickly. The skin quality is not as good, and they have all this excess skin. So they come for tummy tucks and arm lifts and back lifts and thigh lifts, everything. So these weight loss drugs are leading to the same thing. People are losing weight quickly, precipitously, and they're presenting with excess jowls in their face,
Mm.
hollowing in their face, excess tummy skin, arm skin. It's pretty much a very similar presentation to surgical weight loss,
Hmm.
and it's keeping plastic surgeons busy.
That was funny how you put it at the end. But
Yeah.
yeah, I mean, it keeps them busy too. Like the journey doesn't end if they wanted to then continue from there. Um, so, what other common things do people come to you for, and how long do these like results last? You know, like do they last forever?
It depends on the age of the patient and what surgery you're doing. Nothing is forever in plastic surgery. You're going to be happy. For example, a tummy tuck is a great. Let's talk about a breast lift, right?
Hmm.
You do a breast lift, you do the surgery, thinking about the 10, 15 year time span ahead of after the surgery. You're not trying to get a good surgical result on the table so you can post it on Instagram and make your patient happy for a couple of months. You want to be their last surgeon, right? And every time I go into a breast surgery, that's what I'm thinking. And I actually counsel my patients appropriately, saying, sometimes you have too much skin excess. I need to over tighten you because I want you to have beautiful breasts in 10, 15, 20 years, not just for the first 6 months. So to
Mm.
me, if you undergo surgery and you're happy for a year and then your breasts what we call bottom out or stretch, and then you go back to your breast surgeon a year and a half later or 2 years later, that's a failure to me, right? Like you don't want to keep getting surgery. And
Right.
every time you get surgery, it's harder to do surgery to fix the problem.
Mm.
Um, so you're going for a long-term result. You want as much a permanent result as possible. But going back to your question, when people age, the elasticity of the skin changes. You undergo weight fluctuations, sun damage, just general aging, and things stretch.
Hmm.
So your result is not going to be forever, but hopefully you're going to be happy for a very long time.
Right. I hear that. So what would surprise people about coming in for plastic surgery? Like, is there any factors about them that they wouldn't have known they needed to kind of get together before coming in to see you?
Um, I think every patient kind of comes to me saying, "Oh, you're going to think I'm crazy, but this is what I want." But when you see so many patients, people have the same worries, anxieties, same kind of questions, and you see patterns in patient presentations. So the first one we talked about is some patients come saying, "I want this surgery."
Mm.
And I know that that surgery is not the right surgery for them. And I don't want to give them a 20% improvement. I want to give them a 100% improvement. I always want to do a home run when I do surgery. And, patients will have a back and forth at times where they say, I know what you're saying, but I still want just lipo.
Hmm.
And then I'm kind of in a dilemma where they're like saying it's totally okay. I know the limitations. I know I'm going to have excess skin, but I still, as a surgeon, say no because I just don't feel comfortable doing a surgery that's not a home run.
Right, right,
So we see a lot of that.
right.
The other thing is there's a lot of trends in plastic surgery. If you kind of step back and look at 20 years, you'll see things come and go. But
Mm.
there are
More like a
surgeries,
fad, you're saying?
there's lots of fads in plastic surgery.
Mm.
There's many technologies on the market. There's many things coming out, and you'll see that a lot of them kind of come and go,
Mm.
right? Like they're all over social media. Everyone's talking about them.
Do you think like
Um,
that has to do with what's the thing for your butt called?
for
Like
your
what?
butt, like
Yeah, like when they do a surgery, there's
a
like the
BBL.
Kardashian, a BBL. Like, do you
Yeah,
feel like that sometimes comes and goes?
yeah. I mean, BBLs. There was a look that people were going for at one point, and it's become less popular. Fads are dangerous. I always take a step back when things go explode and are all over social media and all these celebrities are getting them. I don't jump in. I take a step back and I watch.
Mm.
And there are many examples of this. Like there's all these injectables of, dissolving fat, and they work. There's nothing wrong with them. But liposuction has survived the test of time. I have patients coming in all the time saying, I did this non-surgical treatments. Nothing worked. And I know if I had just done a good lipo job on them the first time, they would have saved a ton of money and I would have got the result they wanted immediately.
Right.
So a lot of people are afraid of surgery and they want, fat dissolving drugs and fillers and all these things. And they inevitably come back and say they come back for surgery eventually. Like facelifts are a great example. You spend 10, 15 years of your life doing fillers and all these treatments. But if you have jowls and you have excess skin, you need a facelift.
Right.
And that's going to give you the home run. Tummy tucker is the same. There's all these devices on the market to tighten skin, rejuvenate skin, and there's nothing wrong with them. They
You're
all are.
talking like sculpts and stuff like that.
Yeah, I don't use mSculpt in my
Right.
practice. I have nothing bad to say about any of these technologies,
Right.
but the
But you're
truth
more your
is,
point.
in my hands, I know what I can achieve. I know how to hit a home run,
Hmm.
and people come to me saying, "I want A, B, C," rejuvenation techniques and technologies. And while I have some of these in my practice, I know how to hit the home run. So let me just hit the home
Right.
run. And so many patients are coming back after doing all these for so many years and spending a lot of money.
Right. Probably saying they're so happy, meaning if they did listen to you, saying how happy they are. I think what you're also expressing is that you're hearing what people want, but you're knowing what they need.
Yeah. And at the end, you always do what's right for the patient and what's
Right.
safe and what you know is best for them. And after doing this hundreds and hundreds of times, it's you know the anatomy, you know what
Yeah.
the patient needs. It's not that complicated.
Right. Right. What
um,
about I wonder how it manifests, like, because when it comes to like a person's emotional or mental state and all this, like, is there some way you kind of screen even in the back of your head? Or I don't even know if you have a screening. Like when I show up having a baby, they give me 12 mental health screenings, like just in case. Um, so, and actually with my last one, that really helped because I didn't know to flag certain things. So I wonder if you kind of flag things or you have repeat customers that you're sort of like, do we need to kind of talk? Like what's
I
going on?
mean, there are definitely red flags that if I see them, I don't think the patient is a good candidate for surgery, and I disclose this with them very openly. Um, Look, surgery is a big deal, and when you have if your relationship with your surgeon is a long term relationship, you're like their therapist. You're a bunch of you have different hats on, not just the technician.
Yeah.
My every one of my patient has my cell phone number, and they know this. They text me. We are communicating constantly with every one of my patients, irrespective of what's going on. And it's not just like, oh, I'm so happy with my result. It's like exercises. Who do I see for a dietitian? What am I eating? I'm going to therapy. Should I continue with therapy? It's really like multimodal to
Hmm.
be happy. It's, like a good example is if someone is depressed, it's not just an antidepressant. It's antidepressant, exercise, therapy, diet, social supports.
Hmm.
All of these things together, this multimodal approach is how you solve problems and maybe not solve, but treat problems. And surgery is exactly the same. You optimize your patient from a health perspective. You have a very good relationship with them before you even operate on them. You operate on them and get a beautiful result. You follow up with them, you get them to a dietitian, you get them exercising, you're there for all their questions. You basically, it's not just the physical result, it's like the everything together that makes a patient so happy. And I'm there for that, and I kind of guide them towards those things.
Yeah.
And it's so rewarding seeing a patient like 2 years out, and I'm looking at them. First of all, they look amazing, and it's not just me. Like, I know what I
You
did.
could pat yourself on the back.
Yeah, to a degree, I'm very honest too. It's like I know what I did,
Right.
and they come back at 2 years or even a year, and they look amazing.
Hmm.
They're eating well. They're exercising. They're in a new relationship.
Hmm.
They have social support. They're going out more. They're everything. Their lifestyle has changed, and the surgery kind of kickstarted it.
Hmm.
And it feels good because I just started the ball rolling
Yeah.
basically.
Yeah. Well, that was sort of like the little piece that needed to be fit. Like, that's why I even started this podcast and my platform became more wellness in general, because all these different areas and all the different guests I'm having, like you on here, are just all different tools and tweaks you can do in order to find that little click that's like, oh, wow, look how this now spiraled in a good way, like to unfold all the areas that were being buried by this one change. And we're
Yeah,
talking a big change here with surgery, but it can be very impactful if it's your needed change.
totally. And I mean, we need to be nicer to ourselves, and so many people have very negative self-talk.
Mhm.
And what I'm treating as a surgeon is not just a physical attribute. I'm treating the negative thought that the patient is looking at themselves and feeling self-conscious and saying, you don't look good, and I'm not beautiful, and look at my tummy, and my breasts are droopy, and look what I've become. And all this negative thought, we're so mean to ourselves,
Mhm.
right? And so if you help them cure that negative thought by making them look in the mirror and being like, whoa, I look
Mhm.
amazing,
Yeah.
then it kickstarts more positive thinking and more positive living. And you're not bitter when you walk outside and you interact with people in Manhattan. You basically are in a good mood. Um, it's really, you need to attack wellness on multiple levels. And as a surgeon, I help treat up here as much as I treat the physical changes,
Yes.
if that makes any
Yes.
sense.
It makes complete sense. Meaning some people, and not related on a surface level, but some people might be like, "Oh, therapy was my thing. Therapy is what did it. That's the click." Some people might be so buried in something physical, and when they go help it with you, then suddenly that ticked off and solved other things. Meaning it's not a stigma thing. Like, some people this really works for in their journey of what they needed to feel good about themselves, better of themselves, get themselves healthier. I mean, I think we're both in agreement. We kept referencing diet, exercise. These things are all still vital, also with helping the results, but important in this process. It's not an end game just getting a surgery. What we're sharing here is that it opens up all these areas that improve in wellness. I want to thank you so much for coming on. What did we forget to touch on? We have like a few minutes left, or what kind of message could we leave everyone with?
Um, I think we touched on pretty much everything.
I
Just be
really do.
happy, and wellness is an ongoing pathway, right? You're always investing in your own wellness, and it comes in many different forms, and you need to try different avenues. Um, and yeah, I think we're
And go
talking
to
about
experts like you. I think a big takeaway was, and that's why I'm so appreciative that you're on, because you're such an expert in your field and very well respected, and you have great client relationships or patient relationships that are ongoing, and people need to go to the experts and the right sources and get educated. So how can people find you? Let's say they want to work with you. What's the best way to reach you?
Instagram's probably the easiest and most accessible today, and it has my email address, and you can DM me or email me in my office, and happy to hear from anyone.
Yeah, you're also great with just answering questions, so I'm
Yeah,
sure.
I'm always right. I'm between cases right now, so we managed to do this. I'm really impressed.
Oh, I knew we would pull it off.
Yeah,
So your Instagram is at Dr. Stein.
yeah.
Great. Okay. Well, thanks for coming on.
Thanks so much for having me.
Don't forget to hit subscribe or follow me on Instagram and TikTok at Nourished by Beth, or listen on Spotify at the Secrets to Mindful Health podcast.